What's one way in which a child can possibly suffer a brain injury at birth? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston. I'm a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about one way in which a child can suffer a brain injury at birth. And that way deals with a lack of oxygen. Now, before I get deep into it, I want to back up and give you a foundation as to a very important tool that is used in hospitals all around the country today to help doctors and nurses when we are talking about giving birth or we're talking about delivery. And that important tool deals with the fetal heart monitor. That's right, the fetal heart monitor, it produces what we call fetal heart strips. And what this monitor does is it helps doctors and nurses determine how well your baby is tolerating a vaginal delivery. See, it's looking at your child's heart rate. And what we're looking at there is the baby's heart rate staying within what we call the normal range? Or is your baby heart rate too high? Well, when you're talking about a heart rate that's too high, we're looking at an issue called tachycardia. So you're talking about a heart rate that's 165, 170, 180, 190 for a considerable amount of time. That can spell trouble for the baby. On the flip side, we do not want the baby's heart rate to be too low for a considerable amount of time. That can be problematic also. So that fetal heart monitor is looking at things like that. It's also measuring things such as variability. So the fetal heart monitor plays a very important role in helping doctors and nurses determine how well your baby is tolerating a vaginal delivery. Now, if the monitor is suggesting that the baby is in trouble, the baby is having a hard time, then doctors and nurses have to move on that, especially when we're talking about a baby who may have had heavy meconium when the water broke. And if you're new to this, meconium, what that is it's the baby stool. So when you have this going on, heavy stool, you've got a very concerning fetal heart monitor. It's getting a reading that is just really not assuring to doctors and nurses. Then the doctors have to be prepared to move quickly to help the baby out. Because what can happen is if the baby is in distress, then what we can see is a possible lack of oxygen going on. And when we have a lack of oxygen, what are we talking about now? You got it, a possible injury to your child's brain. So why have I taken the time today to talk about a lot of concepts in this quick video? Because I'm trying to help you get insight into this. You may be watching this video right now because your baby is not meeting certain neonatal milestones. And you remember that during birth, when the baby was born, your baby didn't cry. Or maybe your baby was blue in color. Or maybe your baby had to be rushed to the NICU and had to stay there for a considerable amount of time. See, all these things may be going on, and now you realize, you know what? It's time for me to at least speak to somebody about what's going on with my situation and my baby. Well, if you have more questions about what's going on, if you realize that it's now time for me to talk with someone, this is what I invite you to do. And remember, it costs you absolutely nothing to take this next action. And what is that action, Marcus? To pick up the phone and give me a call. I can be reached at 301-850-4832. Or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury questions just like yours all the time. And I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group, LLC. And we will see you next time. Take care and enjoy the rest of your day.